I greet you all beautiful people. So in today's video, I want us to talk about some signs and symptoms of cancer that we shouldn't ignore. My name is Hilda, and this platform is called Aging Happily with Hilda. Here we share health tips. We talk about the stereotype that is surrounding aging. We talk about those lifestyles that can help us to embrace aging happily. We share nursing tips, and of course we talk about our lovely seniors. They are the end products of the aging process. So if this is your first time to this channel, you are welcome. Feel free to like and share this video. Leave a comment about this video if you're loving what we're sharing so far. For our returning viewers, I want to appreciate you all for always being there to support, to watch, share our videos and impact lives out there. So I urge you all to watch this video to the end. There is a reason for bringing this up today, signs and symptoms of cancer that we shouldn't ignore. I have a very good friend, a colleague as well, who died 2 weeks ago because of brain tumor. He has always been having headache. He has never taken that time to consult with a physician to see exactly what is going on with him. He always considered that to be coming from the stress, work stress, family dynamics, but it was actually something going on of which nobody knew, no one knew. Until last 2 weeks, it got bad. The headache was persistent and he couldn't stand it, he couldn't bear it anymore. So he went to the emergency, and guess what? It was diagnosed brain tumor. Unfortunately, it was just too late. 2 days later, he died. That was so touching, and I thought it wise to just come up today and share this with you. Sometimes we ignore certain things like headache, maybe out of ignorance, just negligence, I'm not too sure. But please, if you're having some of these symptoms that I'm sharing, try to touch base with your doctor. Try to just share what you are feeling. It doesn't hurt. Better safe than sorry. Just a disclaimer here before I get into the signs and symptoms. You might get some of these signs and symptoms mimicking with other disease processes. Yes, but the proper advice, I'm telling you, just touch base with your doctor if you are not sure what is going on with you. Abnormal periods or pelvic pain is a very first symptom that I want us to talk about. It is very normal for most women to have irregular periods, cramps, but persistent pain or irregular changes when it comes to your cycle can be indicating cervical cancer, uterine or ovarian cancer. So if you begin to feel some of those irregularities, just touch base with your doctor and they will give you a proper advice. Again, changes in bathroom habits. You want to know that significant changes in bodily functions can be indicating colon, prostate cancer, among other cancers that you know. There are signs attached to this that I will really want you to know. Nothing to take lightly here. Warning signs include persistent constipation or diarrhea, black or red blood in your stool, black tarry stools, more frequent urination, and blood in your urine. These are signs that you shouldn't ignore if you experience them. Just as I mentioned earlier, some of these signs or symptoms can be mimicking with other disease processes. For example, somebody who is diabetic will experience frequent urination and most of these bathroom changes. But how do you know if you are not a specialist, if you are not a physician to make that diagnosis? So just go to your doctor and express your feelings, your observations, and they will be in a better position to help you out. Bloating is another symptom of cancer. We all feel bloated every now and then, but bloating for weeks, say 2 weeks and more, could be indicating ovarian cancer or other forms of gastrointestinal cancers that we don't know. Breast changes is another important symptom of cancer. These include dimpling, new lumps, discoloration, changes around the nipples, or just unusual discharge that you didn't have before. So if you experience this, it's good to consult. We always believe that these signs will occur mostly in women, but just men can develop some of these signs as well. What about chronic coughing? Just cough that persists for weeks, especially dry cough, can be a sign of lung cancer. It sounds very simple. Trust me, very, very dangerous. So you someone who is having dry cough and is persistent or taking that long, check that out. Chronic headache. Headache that is persistent, that lasts for more than 2 weeks, could be caused by a brain tumor. This is so sad because it's actually what killed my friend, my colleague that I mentioned at the start of this video. So don't ignore, especially if the treatment or the medications that you take usually when you have headache, if it is not responding to that treatment, then you need to take an action right away. Difficulty swallowing. This is a very huge symptom of cancer. If you feel as though food is getting stuck on your throat, or you're having difficulty swallowing all the time, and say this is going for over 2 weeks, there's something wrong. It could be sign of throat or lung cancer or stomach cancer, any of those. How are you going to know this if you don't get in touch with your doctor for proper diagnosis? Excessive bruising. It is very normal for most people to experience bruises, probably from bumps, from falls. If you have a bruise around your shin because you fell, that is normal. But suddenly getting bruises around your body in unusual places that you didn't fall, you didn't have any bump, could be indicating some blood cancers. Some people might be confusing. As I mentioned, some of these signs and symptoms mimic with some other diagnoses. So someone who is on a blood thinner, for example, could be experiencing or having bruises constantly. But until you get to somebody who can make the differences out for you, you will not tell, you will not know. So always advisable to check that out and be sure to have that peace of mind. Again, oral changes, persistent sores, painful areas around the mouth, especially for someone who smokes or drinks heavily, can indicate oral cancer. Skin changes, for example, simple birthmarks. If you start to experience some changes, maybe in diameter, or it's not symmetric, it's not the same color the way it used to be, it's just good to check that with your physician to make sure something else is not adding to what you knew it was. We all know about persistent pain that lasts for long, that you cannot identify its cause, can be indicating something. Try to check that out to be sure it's not something unusual. Persistent fatigue. This is quite common, but we always attribute this to maybe stress from work, from family. But persistent fatigue, low energy, unusual mood. No matter how you rest, no matter how you sleep, you still have this low energy. It can just be indicating cancer, something like leukemia or lymphoma. How will you know this if you don't talk to somebody who is a specialist to better give you advice to tell you exactly what is going on? Let's talk about stomach pain and nausea. Unusual discomfort in the stomach, nausea, and all what you can think about that can be going in your digestive system that can make you to be uncomfortable. It's good to check that out because it could be signs of liver cancer, digestive problems that you can never tell. If that is persistent, if you're having some sort of discomfort, abdominal discomfort, that is lasting that long, say 2 weeks and more, it's just good to check that out. Unexplained weight loss. Say you begin to lose pounds, that you are not in any weight loss journey, and you begin to experience sudden change, a drop in your weight. You have to think about that and dive into action right away. Unusual lumps is the last symptom that I want to mention here. It is very okay to have lymph nodes when you have a cold, for example. But if such lymph node is not going away, it's just staying there, after you are feeling well, then it's good to touch base with your doctor, because it's obviously not normal. This is bringing us to the end of this video. I really want to appreciate you all for watching to this moment. It's always a pleasure to have you on. And remember, we are here to impact life. So the best way you can do this, as I'm doing to you right now, is to share this video. Let it get out there, reach to so many people, so that together we can be healthy, together we can embrace aging happily.